Welcome to our talk about art therapy. We're really glad to be here and work with Westfield College students. And here's a little overview of art therapy. So we want to know, just quickly, what do people know about art therapy? What have you heard about it? Yeah.
It can help reduce anxiety and stress.
Okay, art therapy can help with anxiety and stress,
I know it can be used to help people like move forwards with traumatic events, sort of move past them.
Okay, it helps with traumatic events, yeah.
It can be used to help express like feelings that words struggle to express.
Yeah, it makes things easier to express, especially feelings. And I have another colleague here, Danielle, who's here to join us. Thank you, Danielle. Okay, we'll tell you a little bit more about art therapy. So this is a definition about art therapy from the American Art Therapy Association website. And all of you can go on the website and see all the amazing different things about art therapy and where art therapy is practiced and what's going on around the country. And basically, art therapy is another mental health profession that enriches the lives of individuals, families, communities through active art making, creative process, psychological theory, and human experience with a psychotherapeutic relationship. And on the right-hand side, you see a work by a client of mine who had a chronic schizophrenia. And unfortunately, during the time that I met him, right before that, he was locked up in the back wards of a hospital. And through our work for a couple of years, he was able to move into a community setting and actually work in the community. And sometimes you see with individuals experiencing psychosis that it's hard to see the figure from the ground. Even though it's watercolor, it's like what's the figure and what's the ground sometimes gets blended. Okay, next slide. So here we have Jackson Pollock. He wasn't a client of mine. Oh well. If he was, then maybe his paintings would have changed. No. But Jackson Pollock was very much a process-oriented artist, and the process was very important. And in art therapy, the process is important, but sometimes the product is important. So sometimes for somebody to make something that they could feel proud of is very important. And in art therapy, there's often unexpected insights from what the person is making, because art is a vehicle of communication, and it's really healing, life-enhancing. It can foster self-reflection and self-esteem. I was working with a little boy yesterday, and he really wanted to do bead weaving. And I told him bead weaving, that's very difficult. Even adults have a hard time with bead weaving. So I said, you're going to experience frustration. Do you want to do that? And he said, yes, I want to try it. And I said, okay. And I said, okay, so let's see, how it goes. And he was able to experience frustration until he finally said, you know what, you're right. It is frustrating. And I think right now I'd like to not do something that's frustrating and do something else. So it was really great that I got to see how he dealt with frustration in a very supportive relationship. Okay, let's go on to the next slide. In art therapy, there's no failure. It's not like, oh gee, that didn't look good. And the important thing is symbols, forms, the content. And what we can do is often we want to help the people recognize their personal insights beyond the session. So I wanted him to recognize how he dealt in that session with frustration to schoolwork, to other situations in his life. The strengths and the needs of the individuals are valued, and it aids physical coordination, fine hand development, problem-solving skills, It's just my favorite thing to talk about because it does so much. It's incredible. It increases peer interaction and cooperation, body awareness. Let's move on to the next slide. So everybody says, oh, art therapy, it's a new field. Well, it's not. Hey, it's as old as communication and symbolization and talking to people through pictures, which is our ancient cave people. And then it really sort of like, people weren't really thinking about it until the late 1800s when psychiatry sort of became of interest. We have Sigmund Freud, and well known, and other people. But the first book was called The Artistry of the Mentally Ill, and it was written in 1923 by Hans Prinzhorn. So I don't think art therapy is so new, 1923, anyway. And then we have all sorts of artists who collected children's art and were very interested in the art of children. And we just did a field trip at Springfield College, and we went to the Institute of Contemporary Art in Boston, and they had a whole show about artists who were inspired by children's art. And Adrian Hill was a British art therapist, and he talked about the impact of painting on recovery from tuberculosis. And it used to be that in the tuberculosis wards, which nobody could go into because afraid of catching it, they would have easels, and the people were encouraged to paint. And that was seen as healing. And here, of course, there's a cave from Lascaux cave paintings. So the roots of art therapy also included Freud and Jung, who Jung did his own art. He did this incredible book called The Red Book of his journaling. We have the artist Dubuffet, who started the whole movement of collecting art by people who were considered outsiders at that time, people who were exhibiting mental illness, who maybe lived outside of society in alternative housing sort of things in the woods, people who were prisoners, and he collected their art and looked at it and really looked at the first sort of interest in outsider art, Jean Dubuffet. And the Dada movement and the Surrealistics were also, they went into the psychiatric hospitals of the day, and they looked at and collected art that was happening there. Victor Lowenfeld was one of the earliest developmental art educators who also looked at art done by children who were blind. He worked with clay and kinesthetically with children who were blind. Cliff Joseph, African-American art therapist who worked in New York City on the streets and in centers and in psychiatric hospitals. Margaret Naubert and her sister Florence Kane, and we had Frida Dicker Brandeis, who did art with children in the Holocaust, in concentration camps, and was killed there herself as an educator. And one of her students who was able to flee and came to America and started an art therapy graduate program at NYU with Edith Kramer. And this is Edith Kramer when she came to Springfield College to give a lecture. And unfortunately, Edith passed several years back. So how did I get interested in the field? Okay, I'll tell you my story if I have to. So for me, I was an undergraduate student, from UMass, and I decided to move to the Boston area, trying to get a job. And I got a job working with individuals who were development delayed at an institution at that time, because people were put in institutions still at that time. Now we have trying to close down institutions. Anyway, so I was working with somebody who was very regressed, and my boss said to me, Simone, up the street is an organization called Art to People. Maybe you'd like to volunteer there, because I know you can't do art in our situation. And I said, okay. So eventually I became the director. But anyway, at one point I was working with, we did art to many groups of people all over the state of Massachusetts. And one time I was working in a jail, and I had got a grant, because in order sometimes to do art therapy in alternative institutions, you need to get grant funding. So I got grant funding, and what happened was that I got a grant to do pre-vocational work. So I'm dating myself. Okay, we used to do, I don't know if you could see that one, macrame. And I used to do macrame, and we would, the men would make it. It was a male correctional institute. And they would make it, and I would bring it to a gallery in the town, in the little city, and the gallery would sell it, and the money would go back to a victim retribution project. So the money would go to victims of crimes, which was working really good until one day the warden called me up and he said, "Oh, you really need to come and see something." And I said, no, I can't. I have to go over to the nursing home here. I have to go to this place. He's like, "No, you have to come." What did I see? I saw, not this particular one, but I saw a wall hanging. And I said, "Wow, that's amazing. Who did that?" The person who said they couldn't draw, they couldn't paint, they couldn't make a straight line. What they did was, they were in my crafts group. They stole little pieces of yarn and they tied them together and made what they said was a wall hanging, but actually it was a ladder, and they tried to escape. So that's when I figured out, I need to learn more about creativity and motivation. Here's somebody who was totally unmotivated, but he had a reason to motivate himself, escaping. So once he figured out that he could use art to escape, he got interested in the art classes. Yeah, so I thought, I need to go back and learn more about creativity. I got my master's in art therapy, and I got my doctorate in creativity at UMass Amherst. They used to have a doctorate in creativity. They dropped it. They should bring it back. Anyway, so that's my story of the macrame, and then this is my story of when I started working in my master's program with people with chronic schizophrenia at Mass Mental Health Center. And this was my client who was just so creative. I mean, he used to lie under the piano and cry and scream and so forth. And he was often in the back wards, but once he did art, he couldn't stop drawing. And this is his picture of friends having coffee. And obviously he was in a place that had bars on the window. So, because he used to try to run out of the center and run to the local church and say that he was Jesus and he was the Pope. And then he would go back, the police would take him back to our center whenever he would run out. But he started seeing himself as a new identity, as an artist, rather than a mentally ill person. But that's a longer story. I have an article on it if you ever want to read it. So let's go on to the next. All right, so what do art therapists do? All right, next. We do a lot. Okay, so we do treatment plans sometimes, we do assessments, we do diagnosis, we do research. We provide consultation to psychiatrists, psychologists, social workers, OTs, PTs. We're knowledgeable about many things. We learn courses in human development, psychological theories, clinical practice, spiritual, multicultural, and artistic traditions, and materials and techniques of art. So where do people work? Well, some people work in hospitals. We have some graduates of our program at Bay State Hospital working with children. We have some graduates of the program at Hartford Hospital working in the cancer unit to help people feel more relaxed. So it's not psychological, but it's helping them relax and have something to do. We have people graduated our program who work in hospice. We have people here in Westfield at Western Mass Hospital, and that's actually a graduate of Westfield State. She's there now. And also at clinics. Heidi is working in a clinic right now in West Springfield, community agencies, educational institutions. We have, there's an art therapist for undergraduate students at our school. Our school hired an art therapist because they believe in it so strongly, Springfield College. Also, Western New England has an art therapist, and Bay Path. So you should advocate, they need an art therapist here as well. Okay, senior centers, rehab centers, forensic institutions, eating disorder programs, substance abuse facilities, private practice, so many. There's even more than this list. Okay, so some of you might be in art education, but you might say, well, isn't it just an art teacher? Well, no, because the process is more important, the emotional language is more important. We do simple materials, we're not gonna do certain types of printmaking, we're not using oil painting. We use open-ended questions like, can you tell me a story about your piece? And we do non-directed and directed. Sometimes people like some directions, like draw a picture of your family doing something together. And sometimes people like non-directed, do whatever you want. Okay. So both art ed and art therapy encourage respect for materials, feel that art strengthens our self-concept, develops creative thinking. However, in art therapy, the relationship with the therapist is very important. Okay. So there's some myths. People don't really understand art therapy. They think we can look at this painting here and analyze it and tell you what's psychologically right or wrong with the person. That's not what we do. And some people think that we have nothing to do with art history. Art history is important. It is an inspiration for many clients to make them feel that they can also create like somebody else who's well known. And some people think art therapy is just, pouring paint on a canvas. It's much more than that. And not every mental health professional can do art therapy because it's about the relationship and therapeutic issues. So some people use art as healing. One of our students works at a place in Hartford where they actually paint with people with developmental delays and physical problems, and they sell their paintings, and they do that as healing. They feel better about themselves, they're relaxed, they get to talk to each other, they have socialization skills, many things are learned about that. That's more art as healing. And we have art as an injunctive therapy, so art therapy along with other types of counseling or psychology. Our school teaches about art psychotherapy, where both things are done at the same time. We also do assessments, and some people work in hospitals. One of our professors was working at Yale Children's Hospital for quite a while with children with chronic diseases and illnesses. Here's one of my clients who just could not deal with the little paper and needed to get it off the little paper, and so I took him outside. He loved drawing on the blacktop. So we do assessment of anxiety and depression and emotional problems, substance abuse, family issues, domestic violence, and also, of course, we have a class in trauma-informed art therapy. Some people are interested in neurological issues and psychosocial issues related to medical problems. So a little bit about medical art therapy. Here I have a painting by Frida Kahlo where she paints her doctor and her palette is her heart. And she's in her wheelchair. We probably know the story of Frida Kahlo, the famous Mexican artist who suffered a lot of physical problems in her lifetime, finally had to have her foot amputated. She didn't do art therapy, unfortunately, but in medical art therapy is a whole field which has to deal with understanding the confusion and the painful parts of illness. And when you're in the hospital, you don't have a choice. You know, they come in, they put you on monitors, you know, they check your vitals all the time. But with bringing in art making, you could choose what you want to do. And the role of the patient is de-emphasized. Individuals with illness can feel a sense of mastery, and it could help with adaptive coping skills. And one of our grads is now the art therapist, I said, at Bay State Hospital. And there was an art therapist at Cooley Dick as well. So as we know the saying, art can express 1,000 words and it can help people cope. It could be a link to a formal identity. So in my work with refugees, it's sort of a link to a former identity of who the person was. It could be a bridge to the future, especially when you're experiencing different disasters in the world, like earthquakes and tornadoes and things like that. Art can help portray hope as well as despair, and can assist with the understanding of horrible events. This was a Polish prisoner in World War II who was put in a concentration camp. He wasn't Jewish, but he was in a concentration camp for 4 years and saw incredible, horrible things. And in his 80s, he had a stroke. And the doctor said, put a pencil on your hand, see what might come out. And he started making these incredible drawings of his memories. Self-expression is so important when individuals have no power and are voiceless. And art can illustrate optimism even in times of intense adversity. So when we're doing art with people, we have warm-up activities and fun, I hope. Draw how you're feeling as the weather, or use color and line to talk about your mood, or take a line for a walk. Even if people say they can't draw, they can take a line for a walk. Lines could be zigzag and up and down and all sorts of things. Okay, let's go to the next one. So, Springfield College, what do we do there? Well, we blend theory, technique, and process and practice. And we have classes in art therapy, and then we have classes in our counseling program. And we have classes in research. We have research teachers, studio art therapy, like I taught painting for the art therapist. I think right now there's a class sculpture for the art therapist. We've done fiber art therapy. And we also have electives such as trauma-informed art therapy, substance abuse art therapy. And we have practicum and internship. Heidi right now is on a practicum. She'll talk to you in a few minutes about her experiences. So we have 2 tracks. One is the Master of Science and one is the Master of Education. They both lead to working clinically in the field. They both lead towards getting your licensed mental health counselor, which makes you eligible to receive third-party payments like Blue Cross Blue Shield, all the insurances. So both of them have that. The Master of Science is more research, and you do a research project, and you do a poster presentation. The Masters of Education is an arts-based research exhibit. And we do have the poster presentation and the exhibit open for anybody. It's gonna be in the end of April, and you're welcome to email us and come and see it, see what you think. Okay, next. So now I'm going to let my colleague talk for a few minutes.
Okay, so come up front a little bit. My name is Heidi. I am a first year graduate student. I actually did my undergrad at Springfield, so I stayed here. I've kind of gone through every art career possible. I started out doing interior design and industrial design at RIT, which is up in New York. Realized I didn't love creating art for commercial use. It kind of took the fun out of it for me. So, and I actually found art therapy kind of on accident. I had a lot of mental health issues. I went to a residential program. In there, I had an art therapist, and I can honestly say like it changed my life. I was able to kind of uncover some things that I never really thought about before, and I am the person I am today because of that art therapist. And so that's what kind of inspired me to look for art therapy as my career. I chose Springfield because we have a great art therapy program. And I love our visual arts program at Springfield, and I kind of went through art education, graphic design. I was doing medical illustration, thinking about that for a little while. And then I became a senior, and I was like, what do I do? So this picture is a picture of the paintings I started to do my senior year. I really took art for me to be something that was enjoying the process. So I don't plan it out as much. I kind of just go for it and really enjoy it, and it is therapeutic to me. And then after I was kind of thinking like, what do I do with myself as a senior? I circled back to art therapy. I'm really glad I did. I've done a lot of jobs. This is the first experience where I can like confidently say like this is the right fit for me. It took me a while to find that, and so I'm really grateful. And so right now I'm at a community health care center in West Springfield. And this picture is a picture of one of my process drawings. So we have supervision at school, and the cool thing is we don't just write about our experiences, we also draw it out. So I made a drawing of an interaction with a client. This is like a quick sketch of my office, and then kind of showing her energies and how the therapeutic energy is in the room between the client and I. And that's one of the things I love about art therapy. It's like we actually get to do art in class. Almost every class we're doing art. We have huge supply cabinets that I'm always trying to organize, but are just exploding with materials, and it's super cool because you don't have to buy materials. Like I went to art school, my first art school, and I spent $800 in the first 2 months on art supplies. Springfield, they just supply it for you, which is amazing for use in classes. So I really enjoyed that.
You can walk on that.
Okay, don't want to hurt the art. And so I just have, these are some images of artwork that some of my clients have made. I have one client that wants the world to know they're an artist, so they write their name and everyone. And I always tell them, I'm just gonna blur it out because I'm not confidentiality, but every single time they write their name in the middle of the page. So through my first practicum, I'm doing my first experience right now. They definitely have given me a lot of clients, so I've kind of had a lot more experience than we usually do in our first experience. But I'm working mostly with kids, usually 10 years old. I have a few adults too. And surprisingly, every one of my 12 clients that are kids have wanted to create art. Like I kind of went in expecting like, some of them are gonna be like, I can't draw. Some of them might like to paint, some of them like to do clay. Every single one of them sees the art supplies I have, they go and they like take it all out. It's really amazing. And I just see how much our relationship, like I've been working with these kids for like 5 weeks now, and our relationship has gotten really good, and they trust through the art, and it's easier for them to talk. So it's amazing to see that kind of working. And so, yeah, I'm in a center where they at first didn't know about art therapy. It's mostly licensed mental health counselors, and they were kind of like, you gotta run every art project by us, like we don't know if it's actually gonna work. And then they ended up seeing how effective it was, and I'm kind of introducing it more in the clinic that I'm at. So you do sometimes have to advocate for yourself, that's part of it, but it also helps with the counseling end, so you kind of have both. And I guess Springfield College-wise, it's definitely a lot smaller than this campus. I came on here and I was like, oh my gosh, very big, but very tight community. Our professors are amazing. They all are experienced art therapists, so it's really cool because they tell us stories about their clients. Like I think that's what's most helpful for some of the students, is just listening to all the experience our professors have, and super interesting stories. And a lot of support too. Our cohorts are pretty small. I don't know if there's 9 or 10 in my class, and we've all become very close friends and very close supporters, which is really nice because it's definitely a tough field at times. So it's good to have people you can lean on. So I wondered if anyone had any questions about what it's like to be a grad student at art therapy at Springfield. Feel free to ask now. If not, it's okay. Yeah.
How many classes do you take a semester? Like, what is your day like of an intro semester?
So it depends on the track you do. If you do the MS, the research, there's a few more classes. I'm typically taking 15 credits a semester, so that ends up being 5 classes. Math's not my strong suit. So right now I have class Monday, Tuesday, Thursday, and in between there I go to my internship or my practicum 4 days a week. Normally your first practicum isn't that often, I just go a lot. I somehow still have time for free time. It's definitely busy and a lot of work, but I love doing it, so it doesn't feel like work. But definitely it's a step up from undergrad, I would say, for sure. A little more than I expected. However, it's like stuff you really want to do, and so that's kind of what makes it different, I guess.
It's a little more like self-learning and not teacher learning. Is that what you mean by the difference between undergrad or?
Yes, definitely more outside work, like readings, to go and understand things, and it's also applying in the field. Definitely in my internship, I feel like I want to, or practicum, I keep saying internship, it's my practicum. I kind of want to keep working on things, so I tend to spend a little bit more time on it. But I would say the homework load is not too bad. Again, it's all very applicable. It doesn't feel like any busy work, which is really nice. And the counseling class is a little different than art therapy, right? So our art classes we're doing art usually, we're having conversations, we're learning. The counseling I've experienced is a little more like lecture-based, like a typical class. So it's kind of nice actually to have those two things balanced, like a change of pace, which I enjoy. Yeah. Any other questions?
You go into school all year round, or you just do fall,
Yes.
spring, summer?
So we do, typically, and it changes for everybody, you can also, it's kind of flexible, but typically you go fall, spring, summer, fall, spring.
And then you're done.
And then you're done, typically. And the way the site work works out is that your second semester, so for me, my spring semester, my first year is when you do your practicum, which is 100 hours in the field. And then the next year you do internship, and it's split up between the 2 semesters. So you do 300 hours in the field one semester and 300 the next. And if you're doing the research project, that's when you'll start to kind of develop your research and think about the study that you're going to do, which is a really cool option as well.
Would you say it's possible to be like a full-time student and full-time at like a job?
We have quite a few students that are doing that, yeah. Definitely, I mean, we have a student that just had a baby and she's a new mom and a grad student. So I know I have my job with Simone, and then I have my practicum and school. And I know someone that works 40 hours a week and still manages to go to classes and get everything done. So I would say it's possible, and Springfield's pretty flexible with stuff like that. It's definitely possible. It is definitely challenging, but I see a lot of people, like we're all doing like 7 different things and somehow we're all still pulling it together. So definitely possible. Yeah.
Also, full-time for federal financial aid is only 9 credits, so some people choose not to go over 9 credits.
Mhm.
But that means it takes a little longer to graduate.
That's a good option though, since 3 classes. Not too bad. Okay, and I did make a QR code, so if you want to check this out, this takes you directly to our Springfield College Masters of Art Therapy and Counseling page. On there you can find more details about how to apply, the curriculum. There should be some sequence guides that are pretty accurate. We're still trying to work on making sure they're completely good. And just more about the program and more about some of the things that our grads have done. So if you want to check that out at some point. I hope it works. This is a new skill I learned today.
It's working. They're
Oh,
I
that's
see
okay.
the screen pop up, the page pops up.
Perfect.
Did you guys, I had to step on, I apologize. Did you guys talk about the counseling to the research, the difference?
Yeah, the two tracks.
Yeah.
So the MS is you do a research study at the end. So for example, someone that graduated in the fall did a study on gender affirming care, I believe, that was B. And so they did a research presentation and poster. And then everybody, whether either track that you do, you get to have an exhibit. Our gallery is a little bit smaller, but we do an art exhibit at the end. The MS is basically a few more research classes. The MED does arts-based research, which I'm still a little shaky on. Someone wants to explain it a little bit more. But the basic difference is the type of research between the two.
So in theory, one is more towards you're providing therapy to people, and the other one in theory is more, I'm doing research on this topic that you may use in your therapy to the person.
In both, you're going to be working with people. The MS is typically for people that might want to pursue their PhD and do research in the field further. But either way, you're still prepared to work with people and work in the field after, yeah.
Okay, here's our summary. Art therapy is a mental health counseling profession that uses the creative arts and the process of art making to improve and enhance the mental, emotional well-being of people of all ages. That's the thing, you can work with children, little children, all the way up to people who are dying. And it's based on the belief that the creative process involved in artistic self-expression helps people resolve conflicts, problems, interpersonal skills, manage behavior, reduce stress. It's just wonderful. What else can I say? And achieve insight. Okay, next slide. Questions, we can move on to the next one. Okay, we thought we'd do a little tiny experience. And we're into really small experientials because I know that, you know, it's midterms for us anyway, and there's a lot. So we are going to make mini books. So Heidi will explain the experience, and you don't have to do it, but you might like to. So we're into things that you can keep in your pocket that will remind you of your strengths and gratitude.
So I've actually been doing a few of these with clients. The little kids love to do it, like you get for their stuffed animals and dolls and stuff like that. We also recently did a talk. We weren't in India, but we were in India via Zoom. We were talking about tattoos and symbolism, so we made little booklets. But we have some little pieces of paper that you can kind of fold like an accordion. And what were we thinking? I forget.
And we were thinking that you might, because it's the end of the semester, you might like to write down something or remind you of letting go of stress and things you're grateful for. And it could be a symbol, like a heart, or it could be a word, it could be somebody's name. And then you have these little books that you could put in your pocket or your backpack or whatever. And when you're feeling stressed, you're like, oh yeah, there's all these friends I have and supports and my cat, my dog, and yeah.
Should pass.
So we're gonna pass around some little pieces of paper that are perforated.
Most of them are.
So Simone came and talked to the art department's first year seminar class last year, 2 years ago, let's say. We were meeting during Zoom. And most classes, the students were good, they paid attention and all that stuff. I think she's gonna do a similar project. When we did this project on Zoom,
What did we do, Dave?
I don't know, you have to draw something, rip it apart, and remake.
Yeah.
And everyone was
I remember.
relaxed and enjoyed it.
Oh,
And
good.
it was ever in tuned. I was like, wow, this is like, we're receiving what art does. It's therapeutic for us as people in general, but it was cool.
And we have some marking instruments that Heidi is going to hand out to you. And this is just a piece of paper that's folded, that's all. You could always make your own accordion fold. And while she's doing that, I want to introduce you to Danielle, who is also somebody, part of Springfield College.
Yes.
Welcome, Danielle.
I am here, I work in graduate admissions. I'm so sorry I'm late, my GPS did not calculate for farm roads and construction and tractors. I have business cards. The QR code that you guys scanned earlier will bring you right to the page. I highly suggest doing the online inquiry form. We don't send a ton of emails, but it is a good, I always tell students that are completing an undergrad degree and thinking about grad school, you're busy, you're working on what you should be working on, which is your degree right now, but if you get on our email list, it's just a good reminder to kind of like, if you get an email from us and it pops up like, oh right, that was a life goal I had, that was something I was trying to aspire to, because you get busy in the work that you're doing right now. But we're also, we're not that far away. If you want to come to campus for a tour, we can coordinate that. If a few of you want to come out once, we could definitely work something out. I definitely think we should coordinate to get you maybe to the poster presentations in April if you're interested. That's really exciting. I know I came down to campus last year for also the day of our graduation, the art therapy. They have an art opening in the gallery there, which is really beautiful as well to see. So that's a nice way to kind of see, if you're thinking about this program, how it ends, which is always exciting to think about and have that in your vision, your line of vision as you think about it. But I'm here if you have any questions about the admissions process. There is no application fee. So if you are seniors and you're thinking about it, you can hop in there at any time just to kind of see what we need for the art therapy program. It's your transcripts from here, any other transcripts from any other colleges you took if you took community college credit before you started here or while you were here, anything to complete your degree here. Letters of recommendation, portfolio, and an essay, and resume.
Because you're students here, you need less recommendations.
Yeah, they would lower just to one.
Right,
Yeah.
one recommendation only. And we don't have an interview for students from Westfield, yay!
Yeah.
Because your professors are sure that you'll do a good job in grad school. And Heidi has our brochure. And we want to also invite you to a couple of things sponsored by the Graduate Program Division of Performing Arts Department. Some of you know about the thing called the Art Salon, right? It's across Western Mass, and it's where artists present their work and talk about it. Well, the next Art Salon will be at Springfield College on Thursday night, the 23rd, March 23rd. If you forget about it, you could just email us, we'll tell you, or email Art Salon. And we invite you all to come to the Art Salon talk, where artists will be talking about their work, some really interesting artists. And then also in April, we have an alumni of the Art Ed program who's been doing Art is Healing, and he's now a video person, videographer, is that the right word, and a filmmaker, and he's been on PBS with his work. He's won some major awards, and he's going to be presenting his work on his father's stroke and his father being in a coma and what that was like for the family, and he's going to be showing the movie, and that's going to be in April. So we have those two events that you're more than welcome to come to, and we always have other events too, right, Danielle?
Oh yeah, it's busy campus.
So feel free making symbols and words of things that help you with your stress. So when you're feeling stressed, you could take out your little book. You're not cheating on your exam, but you're just feeling supported.
So in the room here, there are mostly psychology majors here.
Great.
Okay. So what's the mixture, or is there a ratio? Do you guys find like people who went to art undergrad to psych undergrad? Is there one more than the other, or?
Yeah, so that's a good question, David. Sometimes we have people who majored in psych and took some art classes, And other times we have people majored in art and took some psychology classes. So it really, it doesn't matter. You can do it either way. Yeah.
I'd say it's 50-50 for at least my group of my class, pretty split down the middle.
Our undergrads, like,
Yeah.
and majors, not saying they didn't take classes.
Yeah. And the idea is you don't have to be a fine artist, but just enjoy the process of creating, and taking line for a walk. And it's not about having to make photorealistic paintings. Good question. Other questions?
I know that Simone's artwork is really good. Not just like hyping her up there, but her own personal work is.
Well, thank you,
She is a
David.
very good fine artist.
We have a faculty show right now. You're also welcome to come
Nice
too.
segue.
It's up for another couple of weeks. Do you have spring break next week?
Yeah.
Oh, yeah, we do too. It's still up after spring break, and I'm also curating a show on resilience, and that's gonna be in April in the Student Union, in the Rotunda.
Okay.
And there's also the art show, as Danielle said, not only the end of the year art show, but the arts-based research art show, which is also going to be in the Rotunda. Yeah. And we have like art for older adults, and we actually have older adults who come to the art department and do art with us as well. And we also have an incredible amount of sand tray therapy toys.
Whole cabinet, yeah.
Because we collaborate with the Western Mass Yoga Association, for those people interested in psychology, and there's a small student fee if you go to their things, which is one Friday a month, online on Zoom, and they're very interesting if you like Jungian psychology or want to learn more about myths and metaphors.
One question I have, which I've been asked many times, does the license you obtain,
The what?
the license you obtain to be a therapist,
The license.
yeah, does that travel to Vermont, New Hampshire, Mass?
Okay, what a good question. You have good questions. Okay, so
I get asked this a
art
lot.
therapist can be ATRs, which is registered art therapist, and board certified. In certain states, that's all you need to get third-party payments. In other states, such as Massachusetts, we're under licensed mental health counselors, which also your counseling master's program here is under, licensed mental health counselors. And the question was, is it reciprocal in other states? Well, some states yes, and some states no. So it really depends. We have knowledge of all the different states and so forth. Some states you have to take a few more courses, like in Florida, you have to take human sexuality. I don't know, maybe it's because it's warmer out there, I don't know why.
So he's gonna cut that. Don't you worry.
Oh, you think so? Okay. And in Connecticut, you have to take career counseling.
It's crazy down there.
So I'm not quite sure, why Connecticut thinks that all therapists need to learn career counseling, but we do. So each state is a little bit different, and we'll help you with that. Massachusetts doesn't have career counseling or human sexuality as a requirement. But that all comes way after, so it's stressful to think about licensure right now.
Yeah, I don't even think about it.
No,
I go day by day.
Cross that bridge when you get to it.
it's a question that I often get asked, and I'm like, because, with education, sometimes it does this, and with the Massachusetts licenses, sometimes there's typical other places for official higher education. that kind of stuff.
Right.
If you guys do want to receive an email or receive stuff, besides the QR code, if you guys didn't get that, just write your email down on that piece of paper so she can take a picture of it and take it home with her, and then she can hit you on the email those too. if you-
Great, excellent, and thank you for having us come today. If you want to share your little books, we'd love to hear it.